Emerging technology. Mesotherapy. The goal of mesotherapy is a reduction in fat by dissolution in non-invasive nature. It involves injection of phosphatidylcholine, deoxycholate, and/or other agents with the aim of dissolving fat deposits. Focused external ultrasound therapy. Depending on the technology, it can be thermally or non-thermally mediated, via cavitation. There is no evacuation phase, relying primarily on removal by the body's own phagocytic mechanisms. High-intensity focused ultrasound (HIFU) technology is being used for performing non-invasive body sculpting by disrupting unwanted adipose cells. There are two mechanisms that result in ablating the adipose tissue. One is mechanical effects that disrupt the cell membranes immediately. The other mechanism is heat that destroys additional fat cells at temperatures above 58 degrees Celsius, and occurs in the focal spot of HIFU. The result is coagulative necrosis and almost immediate cell death within the targeted area, while the surrounding tissue remains mostly unaffected. Following HIFU treatment, the dead cells induce a wound healing response, and attract macrophages, along with other cells, which engulf and transport lipids and cellular debris away from the treatment area. Most of the destroyed adipocytes are resorbed within 12 weeks after treatment, and 95% are resorbed after 18 weeks. These changes occur with no significant increases in plasma lipids. The wound healing cascade results in attraction of inflammatory cells, followed by fibroblast induction. This, and collagen denaturation by heat, result in new collagen formation, which is followed by tightening of septal fibers and skin. Possible side effects: during treatment, sensations of prickling, tingling, warmth, heat, discomfort, or pain. After treatment, temporary erythema, ecchymosis, discomfort, paresthesia, and edema. HIFU reduces focal adiposity by delivering high-energy ultrasonic waves across the skin at a low intensity before sharply focusing them at the level of the subcutaneous adipose tissue, SAT. At the skin surface, the intensity of the waves is low enough to avoid tissue damage. However, at the level of the SAT, the waves are focused to a high enough intensity to induce focal coagulative necrosis. Dying adipocytes release chemotactic factors that induce a mild inflammatory response, attracting macrophages that phagocytize and clear the extracellular lipids and cellular debris. The ultimate result is reduction of the subcutaneous fat layer without damaging the surrounding tissue. Histopathology then confirmed the presence of coagulative necrosis confined to the SAT with sparing of the nerves, arterioles, and overlying epidermis and dermis. Cryolipolysis. Cryolipolysis, commonly referred to as cool sculpting, is a new and vastly different technology uses cold temperature to break down fat cells. The concept is a controlled cooling of the subcutaneous fat, with destruction of selective fat cells without epidermal or dermal injury. It has the European EC mark of approval and is currently undergoing US-based evaluation but is not FDA approved. Manstein et al. Introduced a novel non-invasive method for fat reduction with freezing in 2007, termed cryolipolysis. This technique is performed by applying an applicator to the targeted area set at a specific cooling temperature for a preset period of time. This targets adipocytes while sparing the skin, nerves, vessels, and muscles.
Cryolipolysis is the non-invasive cooling of fat cells to induce lipolysis without damage to other tissues or structures. Cool sculpting targets and cools fat cells to temperatures that trigger fat cell apoptosis, ensuring targeted tissue cooling, by only affecting fat cells without damaging the overlying skin and surrounding structures. During the procedure, tissue is pulled by vacuum suction between two parallel plates, and precisely controlled cooling is applied to the treatment area. The fat cells undergo programmed cell death, or apoptosis. The body's immune system naturally processes the apoptotic cells, which are removed through an inflammatory clearing process. In the following 2 to 3 months, a natural inflammatory process removes fat cells, resulting in fat layer reduction.
Common treatment areas included the abdomen, brassiere rolls, lumbar rolls, hip rolls/flanks, inner thighs, medial knee, peritrochanteric areas, arms, and ankles. Histological studies show that within 3 months, macrophages are mostly responsible for clearing the damaged cells and debris. Common complications noted after cryolipolysis included erythema, bruising, swelling, sensitivity, and pain. AirSculpt. Next-generation body contouring. Minimally invasive AirSculpt is the next generation of body contouring. Designed to optimize both comfort and precision, this patented technology enables surgeons to physically pluck your fat by the cell, like berries off a bush. AirSculpt reveals your body's natural contours by delicately targeting just the pockets of fat you want gone forever while completely sparing surrounding areas. AirSculpt is a patented procedure developed by Aaron Rollins. Dr. Rollins saw the need for a minimally invasive, more comfortable alternative to traditional fat removal procedures. He wanted to remove the fear and pain of fat removal by creating a technically advanced treatment delivered in a relaxed atmosphere. This patented technology is hardly comparable to liposuction, which scrapes away unwanted fat with a tube resembling a cheese grater. Instead, AirSculpt removes fat cell by cell through a freckle-sized hole while always leaving the treated area's skin tighter than before. For those patients looking for dramatically tighter skin without an invasive lift, AirSculpt Plus Skin Tightening can do so seamlessly without the need for new entry points. Another benefit of AirSculpt technology is that the fat cells remain viable for fat transfer to other body areas. It's commonly performed in combination with other plastic surgery procedures, such as Brazilian butt lift, breast augmentation, or hip augmentation, the hip flip for hip dips. The cannula vibrates 1,000 times a minute, separating and permanently removing the fat cells. The vibrations of the AirSculpt cannula also generate frictional heat, providing mild skin tightening benefits. AirSculpt does not use laser to melt fat. It can be used to enhance select areas like the hands, hips, buttocks, and breasts. AirSculpt differs from traditional liposuction in quicker recovery, satisfying results, and increased accuracy. Patients return to work or their daily routines within 1 to 2 days. The downtime for AirSculpt is only 24 hours. Is AirSculpt laser lipo? No. Many websites claim that AirSculpt is the same as laser liposuction, but this could not be further from the truth. As cosmetic surgeon Dr. Tabassum Mir describes, AirSculpt never uses laser energy, which can cause side effects like internal burns while damaging fall cells, decreasing their viability for a fat transfer. The mechanical speed at which the AirSculpt cannula operates generates frictional heating, tightening the treated areas of skin as the fat is permanently removed. While laser liposuction may offer some skin tightening due to collagen production being stimulated by heat energy, the skin tightening benefits AirSculpt offers are unique to this technique. For patients with loose skin before treatment or those who remove vast amounts of fat, the AirSculpt Plus procedure offers dramatic skin tightening far superior to any laser technique. AirSculpt differs from Smart Lipo. Smart Lipo uses imprecise laser-equipped tools to burn fat, indiscriminately hitting any organic material that serves as an obstacle, whether that be tissue or muscle. Compared with laser liposuction, AirSculpt is a much more precise procedure. AirSculpt cannula is pointed at the trouble area, targeting only stubborn fat and avoiding anything and everything else. The technology will stop if it hits any non-fat compound, allowing the surgeon to precisely and carefully pluck away each fat cell. AirSculpt from Elite Body Sculpture is a new method of permanent fat removal, so it's an alternative to liposuction for anyone considering body contouring, and it can be used all over the body, from the chin to the ankles. It gives lasting results with an average of just 48 hours of downtime, no scalpels are involved and no stitches are needed, plus, it tightens the skin above the area where fat is being removed. Because patients are awake during the procedure, they report feeling both more involved in and in control of the process of fat removal, as their surgeon can consult them as the treatment progresses.